The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, it's a big topic, a lot of attention lately in the news about bioidentical hormone replacement therapy, what you need to know. With us, we have an expert on the topic, Dr. Melissa Dean. Dr. Dean, welcome to the program.
Thank you. Thank you for having me.
Now, before we get into today's topic, tell me a little bit about your practice. Who is your typical patient? What are the different things you're doing? What are the different disease states people come to you to see you for? Let's start there.
Okay. I actually am in charge of Dean Wellness Institutes in Vero Beach, Florida.
Okay.
We have a variety of patients that come to my practice. I have an integrative approach to medicine where I have basically the internal medicine practice, which is your primary care patient and such. And then I have another whole patient population where I try and integrate in and use the bioidentical hormone replacement, balancing of patients' metabolic issues and try and prevent diseases. And I guess part of it would be aging gracefully, that a lot of people...
Is that right?
And restoring some of that zest and energy back to life that people seem to have forgotten that they had in their young years.
We've talked on the phone, and you say that you are convinced that the second half of life, 50 plus, can be the best years.
Oh, absolutely.
Elaborate on that.
Absolutely. We look at our lives, and people who come into my practice many times have forgotten the zest that they had towards life. Stress has taken them down, beaten them down. Paying house payments and the cars, the garages, and the careers. We've gotten sidetracked, and they sort of wake up at one point and have forgotten what it was that they enjoyed and had a passion for in life. And many times they realize they have high blood pressure, diabetes, on the edge of diabetes. The body has changed. Energy levels have certainly decreased for the average patient that I see. And many times then libido becomes an issue. And
sex drive.
Sex drive, absolutely. I have people come in and they realize that they love the person that they wake up with, but many times they've just become partners in life and just friends. And
that's just not part of aging?
No, I don't believe so, no.
You can get that back?
Absolutely.
So you have a certification in anti-aging medicine?
Yes, I do.
Is that correct?
That is correct.
Okay, and you're
yes.
not anti-aging. I mean,
no.
Even the anti-aging group, they say, doesn't like that term.
Yeah, it's a misnomer, the name is.
You're not against aging?
No, absolutely. It's more of aging gracefully, and bringing back that energy into your life. And, we're not talking, I guess Ponce de Leon was always running around for the fountain of youth kind of situation, but we're all going to eventually pass. But what happens is, I think when I first got into this, I tell my patients, when I was a new nurse, the average lifespan was like 68 years old for somebody. And for a woman who's going through menopause in their 50s, to live to 68, I think before we used to say, well, basically just, it'll be okay, just you'll get through it, and what the heck, you only have a few more years.
We're talking about menopause.
Menopause and aging.
Okay.
And so if you're going to start aging in your 30s and 40s, but now your lifespan is you're living to be 80, 90 years old, to live for 40 or 50 years and then die for the next 40, miserably, really doesn't appeal to me nor many of my patients. So I think at that point is where, when we start working on the balance of the hormone replacement, detoxing the bodies, and getting away from some of these, caustic things that are in our environment, to try and help people to restore natural balance in their bodies and help to age gracefully, is more where my practice is.
Are you changing people's lives, do you think?
Oh, on a daily basis.
Like, for example?
Absolutely.
Like, what do you hear?
I've got women who've come into me where they just, it's always sad for me to hear about people who've been married forever, but they're just their buddies and such, and just no energy. I've one woman who owned a marina, she and her husband, and just loved what they did, and it just seemed to always just sort of dissipate, and she had gotten achy and put on weight and didn't have the same drive that she used to have. And she'd been on multiple antidepressants because there were mood changes and such, and a few visits with me and some lab work and some hormonal levels and a little bit of replacement, working on the diet, and she's just so enthusiastic.
Now she feels good.
Oh, very enthusiastic.
Did they say? because you said at the top of the show, you're talking about they lose that zest for life, the motivation. That comes back.
It does, absolutely.
They say that?
Absolutely.
Because it does sound hard to believe sometimes.
It's hard to believe until you see the people day after day go through, in my case, through my practice, and see the changes that have taken place, and how, like she may not run the marina anymore, but she's out there very active in the community and enjoying, and I've had one or two patients where, times are hard, and this isn't usually covered under insurances. So I remember one patient would come in and she'd said, well, times are hard. We've got to trim the budget in the household. And she said, I'll give up my hormones and I'll give up, seeing this doctor and such. And her husband said, no, if he had to get a second job, he was going to go ahead and keep her on the hormones.
Is that right?
And it made such
okay, in the movie Sex and the City, they show, the one person, I don't know her name, but she couldn't get into the country she was going into without her hormones, and immediately she was sweating and feeling lousy and miserable. I mean, do women say that?
Oh, absolutely. And women, it's more.
Like they don't want to be left without their hormones once they get started. I should say.
The changes can be so profound in a female. Once the hormones are reinitiated into the body and the tissues have the hormones and the moods change and the energy increases and such, it's almost like a light switch for many females.
Okay, now, even though it's natural hormones, I mean, somebody can argue that it's still not natural.
A lot of things.
Put creams on and bioidentical hormones or whatever.
Well, they replace the source of the replacement. The creams and such. Sure, we didn't wake up, as infants and have to use creams and things to get these levels. But the molecular structure of the hormones is same as those that occurred in nature itself. And it's not exactly natural to have the lifestyles that we have that destroy these hormones and destroy the organs that produce the hormones. So it's a personal choice.
So you could either take advantage of it or not.
Absolutely, it's not for everybody.
And there's science behind everything we're talking about. Is that right?
Absolutely, yes. This is.
It's safe?
Safe.
But when you read some of the negative articles, and I have too many questions to go negative here, but when they say that, hormones are dangerous, they're going to grow cancers and things like that, is that a concern of the women that come to see you?
Yes.
Or what is your response to that?
I discussed some of the research studies that are out there, some of the pros and cons, the research that has been tossed out in the media that has said, oh, no, it's taboo, take it off the shelves and such. And then what's not always thrown out into the newspapers and in the media are the studies that are showing the benefits from it and that it is not at balanced levels under the appropriate care of a physician, monitoring levels and such. I mean, anything that's out of balance, anything that is not used appropriately certainly can harm the body.
Can cause problems.
Absolutely.
Okay,
yeah.
and some of those hormones in the studies, and I did some internet search, those are not natural hormoons in most of the studies?
Correct.
That are saying negative?
The synthetics, yes.
So we're talking about natural hormones.
This is the natural.
A little bit different, made by a compounding pharmacist.
Large difference between, absolutely. I use compounding pharmacies. Got a few in my area that I use that I have a personal relationship with that I can call at any point. At least I forgot as a physician, I can actually have specific doses, compounds put in different delivery methods. We've gotten so accustomed to writing prescription for one type of a medication. Here you go, take this to your regular pharmacy. As physicians, we literally can have them compound in different bases and delivery methods as to how we.
How do you stay on top of all of the breakthroughs, the new breakthroughs in medicine?
A lot of time doing research, a lot of time at conferences, a lot of networking with other physicians.
You love this.
I have a passion, absolute passion for this.
Really.
Yeah.
Okay, now today people need to know this is a real interview. This is not staged.
No.
You're not reading a teleprompter.
No. I wish it were so easy.
And we just met a little while ago.
Yes.
And I'm not trying to endorse you, but when people come to my website at wellnesshour.com and they'll say, give me a referral for someone that does bioidentical hormones, and say we're not a referral site, but I do tell them if you're going to find somebody, look for somebody that's been through this training in regenerative medicine or anti-aging medicine, this fellowship, because at least you know that they're serious.
I think that's
they're not dabbling, right?
Yes.
I mean, you must feel the same way.
I believe it. I think it's imperative you've got somebody who's got the extra training, who's got the experience that comes along with it. Because as I've just said, anything that's not used appropriately, that's out of balance, not tested and monitored and treated as you would any other medication in your life, can cause harm to a person.
Would you say there's thousands, tens of thousands of women out there, 40 plus, that are feeling lousy, anxiety, depression, as you put it, that don't have to feel that way?
Oh, absolutely. You don't have to live like this any longer.
Then why aren't they doing it?
A lot of people don't know about it.
They don't believe it?
Some don't believe it. I think
they're afraid of it?
Some may be afraid of it. Also, very good points. I think a lot just don't know that what's going on in their life is hormone related.
Okay.
I get a lot of women who come into my practice. By the time they get to me, the husbands push them into it, or they've met another woman at in a gym who is, shared a few stories and such, and they realize, can I fix them? And the symptoms. I have women who say they're not sure if the symptoms are because of the stress, because of the teenage children, or because of different things that are going on in their life, or is this actually a physical thing with the hormones?
Okay, so let's begin with the commonly replaced hormones that you replace or replenish in your practice.
Well, there's a wide variety of hormones. I guess the most popular that I end up with trying to balance out in people would be your thyroid. Is a big one. Thyroid hormones, estrogen levels, estradiol. Your testosterone, progesterone are usually the biggies. You know, I do a lot of monitoring cortisol levels in people. Also seems to be a big one.
Okay, let's start with thyroid. How does somebody know, number one, if they're low in thyroid? What are some of the symptoms?
Low in thyroid has a variety of symptoms. Some of the big ones, I guess, that most people present with are cold extremities all the time. You know, we live in Florida, you know, and women are wearing sweaters and heavy socks and things.
Like hands and feet?
Hands and feet.
Okay.
Cold absolutely would be a big one.
That's thyroid, huh?
That's thyroid. Silly little thing called constipation. Hair changes, nail changes, weight gain, and inability to lose weight, even though, you know, despite your efforts to try and lose it, many times can be. Skin changes, skin can.
So if you can't lose weight the way you used to, maybe you have a thyroid.
Perhaps. Although it is overabused a little bit with the weight changes. I get a lot of women, it's like, it's got to be the thyroid, got to be the thyroid.
Yeah, they're hoping that it's the thyroid.
Right.
Like I had my thyroid checked one time. I was praying that it was a thyroid.
Right.
Maybe this is it.
Yeah, poor little gland that we have, it gets blamed for a lot.
What's it responsible for? I mean, tell us the benefits of thyroid. I mean, what's
thyroid regulates is metabolic regulator. You know, body temperature, the means of which your food's digested. It's just the whole metabolism of your body is pretty much what that little gland, it's the size of a walnut, actually runs.
So the thyroid, now, are there people that are misdiagnosed with thyroid problems? You said, we were talking in the green room, that maybe you look at thyroid differently than others, or maybe you're more aggressive.
Right.
Elaborate.
The standards of which I monitor the thyroid many times are different from the average doctor, mainstream kind of doctor. Thyroid, what's considered to be normal, is not always optimal for a person. And, you know, I have many women who come in who have the classic symptoms, clinical symptoms of hypothyroid, which would be low thyroid, that say, well, you know, I've been told my thyroid levels are fine, they're normal, in the normal range from the lab. And, you know, and I have to go back to my little, you know, hormone 101. What's normal isn't always optimal for that person. You know, some of this is clinical.
So 40, so I'm catching this correct. Okay, so a 48-year-old woman goes in there, and so it's normal, what's normal for a 48-year-old statistically, you're saying may not be normal for her. That
Correct.
may be low for her.
And it may be low for her,
Okay.
and then also, even if it's not an age-related thing, if you're on one end of that normal scale, you know, and you present clinically with all the symptoms of having low or high thyroid, then chances are, even though you're in that normal range, optimal is somewhere different for that individual patient, you know, which I think is important when it comes to hormone replacement. Always remember, everybody has their own little hormone fingerprint. You know, what's good for that person is not good for somebody else.
Is there a lot of adjusting that goes on?
Absolutely.
I mean, back and forth, getting it right?
In the beginning, it could be quite a bit of adjusting. You'd have to, you know, replace the hormone and then recheck, you know, go out and have lab work done and recheck those levels again. And then, you know, you may be able to, you eventually find a level which you're striving to achieve with that patient where they feel good and the levels are coming back normal. And then you can usually adjust those, you know, following up a little bit.
Are these thyroid creams, thyroid pills? What are they?
For thyroid, most of the time you can replace with pills.
Okay.
Some of the other hormones require different methods of getting transdermal, which, you know, I guess you go back to some of the training where you can realize that certain hormones you can give orally and other hormones you don't want to give orally because they can actually cause other problems, you know, if they're given by mouth. And so you have a variety of methods to give it, and that's where some of the fellowship training comes in, that we know the benefits of delivery for each one of those hormones.
Okay, testosterone replacement in women. I don't even think of women as having testosterone levels.
Correct.
So what's the role for them? And what does it do for them?
Most women don't even really know that they do, too, because traditionally speaking, you know, when they've gone for synthetic hormone replacement, just using the term hormone replacement, they've been given different pills and patches and such. They've never even had the topic of of testosterone addressed.
Well, how do they know if they're low? I mean, what are some of the symptoms out there?
Some of the main symptoms that typically present me, I guess the biggie for women is always low libido, no sex drive. The other is energy, lack of energy, self-confidence, the body has changed. I've had a few women have come into me and say, I basically live at a gym. I've tried and tried and tried, and I can't get the body composition. I still have the areas of my body just will not, tone any longer. And they just think that's all part of natural aging because I'm, at this age, this is what happens. And it's not typically. And so some of the other symptoms that I've noticed in testosterone also would be loss of muscle mass, skin change doesn't take place, some of the emotional aspect, but when it comes to emotional aspect, a variety of the hormones can actually cause that. So testosterone.
Now in women, I'm reading on the internet that this could make them more assertive. Testosterone.
It gives women confidence. A lot of women who are out in the work world, workforces these days, the executives, women's, and they can sit in the boardroom or be in leadership positions, but they start losing that self-confidence, that quality of being able to be a leader.
Interesting.
Yeah.
So testosterone has a connection with
absolutely.
self-confidence.
Absolutely.
And there's proof of this. I mean, there's scientific.
There's lots of research out there, many research articles, yes, documenting this.
Okay,
yes.
But what about too much testosterone in a woman? What happens?
Too much testosterone, obviously, all these hormones need to be in balance. So too much can cause, many problems for females. Skin changes would be one thing. Facial hair growth would be another thing.
That's not good for a woman.
No, absolutely not. So all these, and testosterone, if you don't know the hormonal pathway, testosterone can be changed into or converted into estrogen products.
Well, tell me this. Okay, so for women with low sex drive, it'll increase their desire for sex?
Increases their desire for sex also, and also their sensation with sex itself. So, it has sort of a double-fold purpose there.
Okay, estrogen.
Yes.
Tell me about estrogen.
Oh, the old taboo of estrogen.
Okay, all right. You laugh when I bring up estrogen.
I
Why
do.
is that?
I do. Because it's always,
Is it misunderstood or something?
I know. It's partially understood, I think, at least from my perspective.
So you spend a lot of times every week talking about estrogen?
My nurse has this little whiteout board that she's put in every one of my exam rooms because I used to write on the exam tables in the paper on it. She finally has trained me.
Interesting. You're writing all over the
because I'll draw and show people, the hormonal pathway and what we're trying to achieve and what some of the side effects are and such. I've been banned from the exam tables up to the whiteout
dry
board.
erase board. Okay.
I do.
Okay.
And I feel like I put up there and they'll try and figure out what the topic was with the patients after they've left before they erase it.
They'll go, doctor, this is your staff, doctor. It's obvious what the questions were.
What were you drawing this time, doctor?
Okay.
But I tend to write down the typical replaced hormones in the females would be the estradiol, the testosterone, progesterone, and then when it comes to the estrogen products. For me, it's very important for people to understand that there are multiple estrogen products, and that somebody like myself that's been trained, I do know that there's E1, 2, and 3, and it's not always just the overall estrogen level as much as the breakdown, the metabolism of those estrogens that becomes the one that needs to be monitored, that becomes that taboo.
So knowing that I was going to interview you, one of my friends has the problem with estrogen in women, it's going to grow cancers.
Mm-hmm. Yeah, and that's the big fear these days. We've had a lot of...
So is that when you start on the drawing board, right?
I do. I put down E1, E2, and E3, and each one of those is the good, the bad, and what levels...
But it's good for women. I mean, they need it.
Estrogen is a variety of purposes in the body, and you can list this. I could spend probably the whole half-hour show on just the benefits.
Couple of days.
Absolutely, on the benefits of estrogen. The biggies that I deal with on a day-to-day basis would be the skin changes that women have. As we age, we start getting wrinkly and saggy skin, so the collagen, the texture of the skin is improved. And I hate to keep going back on the one that seems to be huge in my practice, energy. When people's energy levels go down, in a female, many times it's just the replacement of estrogen can be a tremendous benefit.
But when I hear estrogen dominance, I mean, don't women already have too much estrogen? Isn't that the problem?
No.
So explain that to me.
It's not always just the estrogen level itself. It's the relationship and the ratio of the progesterone and the other hormone that's with it that's needed to balance it out. So if you've got a 40-year-old woman who's come in whose progesterone level is dropping, but the estrogen level still is higher, then you have the symptoms of that perimenopausal that I mentioned earlier.
Do you always replace both together, progesterone and estrogen?
Yes.
You do?
I do.
Let's move on to progesterone.
Okay. Oh, wonderful. I always say it's the warm, fuzzy hormone.
Warm, fuzzy hormone. Why is that?
Once again, we forget the importance. We think it doesn't have quite as many benefits, perhaps. I guess initially women don't think with progesterone, we just give it because you're giving the estrogen products. It helps people with the anxiety, calming effects, and it helps people with sleeping problems. Many people, and once again, I hate to keep beating the horse here, for people who are fellowship trained, one of the things that I can remember that I learned was the difference of if somebody's actually having a sleeping problem and some of the specific symptoms that you're better off to give it oral than you are to give it transdermal and such. So some little nuances.
So it helps you sleep. Helps with anxiety and depression.
It does. And for those, once again, physiologically who have a uterus, it helps to try and prevent the proliferation of the uterine tissue. It is protective of the breast tissue, proliferation of breast tissue also. So, I mean, it's the list once again.
So it's protective? I mean, is it good for you?
Absolutely.
I mean, with all these hormones, this is off topic, or maybe it is the topic, but by doing this, do you think you're helping the body?
I think I'm helping.
You're protecting the organs?
Oh, absolutely, absolutely. If I thought I were, doing anything else, I wouldn't be doing it in my practice. I'm actually, I think it's the best way to go for people. And once again, protect the organs, because we look at the aging process, and as we age, and on top of it, it's not so much the natural aging is our lifestyles and the toxins and the things that we ingest and take care of. We age our organs, and they don't produce the way they should. So I think when we balance out those hormones, once again, we go back to we are living longer so we can live more gracefully and help repair some of the damage that we've done to ourselves.
We're going to take a quick break. We come back, more about the other hormones. I have questions about DHEA and some of the other hormones you're looking at. And the testing. I want you to take me through the process. A woman goes in, she has all these symptoms. What happens on day one? You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Up next, what you need to know about bioidentical hormone replacement therapy. We'll be right back. You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. A very important topic, hot topic in the news media, and that is bioidentical hormone replacement therapy. Natural hormones, are they good? Are they safe? With us, we have an expert on the topic that says they are safe, done properly with the right testing. And when you take in diet and lifestyle and stress, and it all works together. And you say people can live longer, and the second half of their life could be the best half.
Absolutely.
You believe that?
I believe that.
So lives are changing all the time in your practice.
Absolutely, they certainly are. And it's what keeps me going on a day-to-day basis to see how important it is in people's lives.
What are the first signs of menopause? I mean, how does a woman know?
Well, it varies.
What happens at the beginning?
As in hormone replacement, symptoms vary from patient to patient. I can tell you the typical patient, would be the mood swings, the variety.
Mood swings.
And the variation of the cycle, the menstrual cycle may change a little bit. And then all of a sudden that infamous, oh my gosh, I'm having a hot flash. Is this a hot flash? And, I'm talking to the girlfriends about what is this really a hot flash?
If they're hot flashing, what's causing that? A basic understanding.
The estrogen levels are dropping, and that, once again, the ratio of the hormones has changed. And, it's not always, we think it's always the estrogen product is the issue. Many times for women, it can be the progesterone component.
When you call
also.
these estrogen products, you use product. We're talking about compounded estrogens.
Right.
From a compounding pharmacist.
Well, the topic, the name, I guess, estrogen itself is actually, as I said, was comprised of the 3 basic estrogens that we keep an eye on. So, in my world, it's very precise in the estrone, estradiol,
Okay.
But for the average consumer, it's just an estrogen. They don't know that nuance.
Okay, day one, they're feeling lousy. They have these symptoms, anxiety, depression. They can't sleep, unexplained weight gain, as you say. What happens on day one?
Come to Dean Wellness Institute. I'll fix you.
Okay. When I say that, am I describing your perfect patient? What you see every day?
I tell you, when I shared with you earlier that I sat in front of a doctor, with my symptoms, and I remember his response to me when I said to him, like you, maybe I was interviewing him at that point, how did you get into this? And he looked at me and he said, I treated my wife who was you, and every day I see you in front of me at least 8 times over.
Wow.
And I remember him saying he didn't even need to have lab work to fix me. He knew he could fix me just on clinical presentation alone. And as I do also, I see people coming in and I will have the standard issues that women and men, because I do a lot of men also.
Do they think that they're different or alone?
Yeah, absolutely, right. They just think they're isolated in their own little world. Nobody else would understand, and I have to explain them. No, there's a wide.
Does your face start to light up a little bit, like you're going, "Oh, this is going to be easy"?
Right.
Do you get some of those?
And people feel like, "Oh my God, somebody believes me. Somebody's actually listening to me," and they don't think I'm crazy. Trying to push antidepressants in front of me and such. And there is a time and place that.
But antidepressants work.
Antidepressants do work, absolutely. But we can achieve most, if not all, the effects necessary or required that are produced by antidepressants without having that numbing, dulling effect many times that the antidepressants can have on a
Interesting.
person.
Okay, so on day one, you order blood work, saliva work, what is it?
I guess most important to me, I sit and listen. What are the symptoms? What's the patient feeling? And let them describe to me precisely what's going on in their life. And then I have to, at that point, I have some clinical guidance in the education as to what needs to be ordered. And then we can do either serum testing, depending on what the problem is. And some of the hormones are easily tested serum, and some are better tested in saliva testing. So,
okay. And then what happens?
Okay, so in 2 weeks after I've got the blood work, I bring them back, and then we go over the blood work, and then at that point I can discuss the treatment options, and compound, send them off to a compounding pharmacy to get the appropriate level of the hormones to balance them out, and then follow-up would be in probably 2 to 3 months.
These are creams?
Vast majority are creams.
Do they start feeling better?
Usually for the average patient, I have to say within a week's time, they'll notice a change. And definitely within 2 weeks to a month's time, they've come back with smiles on their faces.
So a month later, you like to see them?
I see them in a month, maybe 6 weeks later. Then
what are some of the things they say?
Wow, they had no idea that they could feel so good.
Really?
And to discuss some of the changes. And then monitoring after that, because once again, the adjustment period with these hormones, and as life changes and stresses, even once we get them balanced out, the stress and things change in people's lives as we go through, and you may have to adjust some of those hormones. So monitoring and regulation of them is very important.
Okay, great. Now, we're out of time. Final message. Woman watching this, she's heard a little bit about bioidentical hormones, like you say, trouble losing weight, can't do it the way she used to, anxiety, depression. She hates her husband all of a sudden. She didn't hate him not too long ago. Yeah. What's your advice to them? And maybe they're afraid of bioidentical hormones. What do you say to them?
Seek out a fellowship-trained physician who has been trained in bioidentical hormones and have a conversation with them. See if this is something that's appropriate for them, and see if they can have their life back again.
Well, thank you for coming to the show. Very good. Very good.
Thank you for having me.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, you could visit our website at wellnesshour.com and just put in Dr. Dean or natural hormones or hormone replacement. You'll find it there. And this information that you talked about today, Dr. Dean, is on your website.
It is, absolutely.
All over the place.
DeanWellnessInstitute.com.
All right, and they can meet with you.
Absolutely.
They
can contact me over the internet, absolutely, from the website.
Thanks. I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.